Welcome to People, Places, and Parables, highlighting people and the positive effect they have in our community.
Hello, this is Chris. My blood type is B positive, and that's my outlook on life. I'm really fortunate today to have a gentleman by the name of Dale Hamilton, who is the Executive Director of Community Health and Counseling based in Bangor. And if any of you have ever seen the logo, like me, you're like, wow, they've been around since 1883. That's not something most of us would think about. Good morning, Dale. How are you doing today?
Good morning. Doing great. How are you?
Excellent. I was amazed looking at the website of the breadth of different programs that community health and counseling has been going for a long time. A lot of things on the plate. What are some of the upcoming things that you're seeing in the future? I know there's a lot of changes going on in Washington. Is that something that you folks are having to deal with in CHNCS?
Sure. Well, no, thank you for having me. I would start with kind of a general statement is that that's part of our longevity as an organization is always focusing back on our mission. And our mission really hasn't changed since its inception when it was developed as a volunteer organization. It's really about meeting needs in the community. We certainly have focused areas of services now in terms of that we look at developing, but that's really what we deal with. So whether there are changes in regulations and policies, those are things that very much are out of our control. But what we do is then we just try to look at how do we respond to that so that we can continue to deliver the kinds of services that we have available to the communities we're serving. So we're always impacted by those areas, but we look at how do we adjust. And our service areas really focus, although we look at what we do is available to anyone. We don't like to put individuals in certain buckets of services because then we end up in a siloed situation and we want to make sure people have access to whatever their needs are. But for the sake of being able to describe who we are and what we do, we really focus on services that are defined under behavioral health, home health, hospice, and then some what I'll term social support types of services.
That's excellent. And I've noticed since moving to the area, learning about a lot of the programs I didn't realize were connected, like I believe it's Stillwater Academy.
Correct. Yes.
If you could share a little bit about that, because I've heard a lot of things about that over the years, and that's something that is so important because, I mean, even Acadia Hospital, for instance, has a lot of young people that are going through challenges. And I know that so many of those different challenges are intertwined, whether it's mental illness, substance use disorder, and of course, the big scary one that we're all dealing with right now is the housing crisis.
Sure. Yeah, so our Stillwater Academy, it is a K through 12 school. The designation is a technical term is a special purpose private school, and what that means is that we operate that program independently from the public school system. However, we very much are part of many surrounding schools. We work with school systems in the area. It's located in Bangor, but we receive referrals from school systems in Hancock County and northern Penobscot County. And it's really intended to support students who are part of the special education system, and schools look to us to be able to augment what they have available to offer. Our goal is to always help to develop plans that can follow the student back to the sending school and return the student to that sending school district and provide some of that information that students are able to stay with us for as long as they need the resources that you have available. The students are always a part of their sending school. So we are very much involved with all of these school districts and supporting students in that manner.
That's excellent. Extremely impressed after all the years of hearing about community health and counseling and then all the information that I received from you recently. The demographic is such a wide demographic, and I think the word community really fits because if you look back at community, for instance, a good example is Italy. When I worked for adoptive and foster families of Maine, one of the things that you don't see a lot of in Italy is foster care because you see a lot of kinship care because the families are big. If there's a challenge that a parent or a child is going through, there's usually, because of the larger family, they'll step in and help. So, um, if you could give me an idea of some of the depth of the programs. I mean, you mentioned seniors. I know, for instance, a lot of people come in directly that are in crisis, and you folks are there for them. It amazes me, all the things that you folks do in the community.
Sure. Our services are intended to be lifespan based. So children, seniors, and we provide that care all the way through in various forms. You mentioned, so on the children's side, one of the services is treatment foster care. That's a service that's for children who are a part of the child welfare system, who
Mhm.
are involved in the child welfare system to support those children who have a need for some additional treatment. And so it's a program that was designed. It not just in the state of Maine, we do also across the country, and it's really about supporting foster families who have more experience in working with children with special needs and wrapping treatment supports around the child, supporting the department in terms of the long-term permanency goals, whether that's reunification or adoption, whatever that might be. That's what we help to foster. And then from there, we've developed a range of services that meet the needs of children in various forms. We by no means provide all of the services that exist in the system of care. One of the things that we really try to focus on, though, is that we don't see ourselves as the only provider of a service. What our goal is to make sure that people, that if they have a need, that we get people connected. So we very much focus on partnerships and collaboration, getting people to the right resources. Um, there aren't enough resources in the system to meet all needs to begin with. So we feel like that's our first obligation, is to make sure we're good partners, and we try not to duplicate services. You'll see that our service area, we cover a large geographic footprint in the state, but the services are very different from community to community, and that's evolved over time in terms of that focus of our mission, not just taking it as a range of services and replicating them area to area. It's really been focused on what does that community need, what do we have to offer, and if there's some value to that, then we brought that forward.
Making those connections is so important. I know, for instance, we interviewed Jason Parent with the Aroostook County Action Program, and as you know, they now oversee Hancock and Washington counties. And one of the things that I've always noticed about Maine, I'm originally a Jersey boy, came up when I was a kid with my parents in the 70s, is the fact that the sense of community and the collaboration and thinking on their feet. And I've noticed over the past couple of decades, there's even more collaboration going on with organizations, because a lot of times the funds aren't there. Um, in terms of, I know that there's different, like the homeless, I'm trying to Region 3.
Mhm.
There's a homeless council, there's Maine Veterans in Need, there's a Maine Reentry Network, there are all these different things. What are some of the, do you have people that specifically do outreach to some of these organizations to see what can be filled in for gaps?
Yeah, we do that in a variety of ways. And a good example is through one of the services, long name, a Certified Community Behavioral Health Clinic, CCBHC for short. And we've been operating that program under a grant for 4 years. When we developed it, we very much reached out to the community, brought in community partners, and developed a model that really was about building capacity within the system of care using existing resources. It's not just our program. It was to engage and have these other providers working collaboratively. So that's just one example. But on a regular basis, our outreach teams, we have a team that works specifically with individuals experiencing homelessness. It's called PATH, And our PATH team is working with all of the other provider types that you can think of in terms of whether it's case management organization, housing resources. We know we need to make those connections if we're going to meet the needs of that population. Our teams are always working with other providers to based on the needs of the people that we're serving.
And it's interesting now of all the encampments that are being shut down and so forth, and the attitude and the administration seems to be if you're homeless, it's almost like it's been outlawed. I've been following the video group Invisible People. There's one of the people that was on there years ago who was living under a bridge in Seattle. She went out to Seattle for a neurological procedure, couldn't afford a hotel. She's a success story. She is now an advocate, and she actually came to Maine, and we're lucky enough to get her over to Channel 5 to talk to Sierra Dubois. Um, One of the things that I've seen personally through Bangor housing is a good example with Old Cape Heart and New Cape Heart. Tom Grogan who used to be with the Housing Authority is now with a different program in town. But one of the things that I've seen a lot of is people that are going through situations, and Cape Heart's a great example. I had 4 little brothers. My second little brother, he and his mother lived over in Cape Heart. There's so many single parents over there, and the interesting thing is that if there's a way to harness that energy and that caring, and that's what they did with this group that meets in Cape Heart, there are a lot of people out there that would love to get involved, that have the smarts, have the heart, but they've never been asked. I mean, I go back to when I was asked by Dennis Haggerty with Partnerships for Healthy Communities, which eventually grew into the Maine Discovery Museum, to be pointed at a great big session and be told, hey, you've got a lot of good ideas. Would you like to come on board? Um, are you seeing that in some of the communities that you're working with? In other words, the best approach to most people is through a peer. So if there's somebody that's struggling as a single parent, who better to talk to one than somebody who's been there and done that?
Absolutely, and I think there's a lot of opportunities for that peer support, the lived experience in whatever area that experience has been gained is that a lot of emphasis is now being placed on that and incorporating that into programs for us. That involves we have a number of peer positions that we've placed within different service types. So our crisis services now have peers that are involved in supporting individuals experiencing a mental health crisis. You have peers involved in some of the other service arrays, and our CCBHC that I mentioned. We have peer specialists involved. And so in the community, there are other organization types, whether it's for children, families who have experienced the systemic care that have that experience. There are opportunities. It's a matter of if somebody is interested, is to really just reach out to those organizations that deliver the types of services that you think you can be helpful around. And I think that you'll find pretty quickly that there are those opportunities now. The system of care is really starting to recognize the value of having individuals who have that lived experience. They're the ones who can really understand what somebody is really experiencing more so than the provider can do. So having that combination really does add value, and I think really at the end of the day helps the individuals to recover from whatever the situation is.
Hmm.
They're able to tap into that, and it's been a great asset to our services.
Excellent. One of the things that I wanted to ask you too, if there are listeners out there or viewers, um, that are interested that have a skill set. One of the groups that we've worked with in the past is retired military. We've worked with people in recovery, and it's fantastic because, as I tell people, what I learned at Hope House from a national campaign is there's a great campaign called Treatment Works, and their motto was really simple. It said, "Trying drugs or alcohol is a choice. Getting addicted is not," and there's a lot of truth there. If somebody is out there and would like to get involved, would like to roll up their sleeves, would like to help improve people's lives in the community, help their community. Because if you think about it, it's all tied together. When I hear people, or I read about it in the paper, people complaining, oh, the homeless people in Bangor, why is everyone coming to Bangor? And I want to say, well, number one, it's a service hub. There are all these different resources. When my brother had his situation, I told the rest of the family, I said, he couldn't have picked a better community to be in to get recovery resources. So if somebody wants to get involved, what are some of the avenues for that?
So I would say it really just starts with reaching out to, maybe it's a provider that you're familiar with. Start there. Some place that you're comfortable calling. We certainly will take those calls. If somebody has questions, we can refer them to the right resource or give information if we have it firsthand. But I think that comfort level. So if somebody wants to get involved, and it's just a matter of picking up that phone and making that initial call and just having that conversation. And as I said earlier, I think there are lots of opportunities for people to be involved. And I think it's important too, the involvement of the community in some of the areas of need really will make a difference. I think we're in this period of time where there tends to be this uh, perspective of it's either this or that,
Mhm.
and missing the reality that it's somewhere in between, and that somewhere in between is about getting more people involved to come up with creative solutions, having the right resources, and getting away from turning it into a this or that type of situation.
Or us or them. And that's one of the things that's interesting too, is when you bring more people in, um, the skill sets. A lot of times, and this is what I've learned over the years too, working as a volunteer and as a paid staff person in nonprofit management, is never assume that somebody that works at a bank wants to be your treasurer. One of the best examples that I can think of, there's a gentleman, his name was Jerry. Jerry worked for one of the large oil companies. Jerry is this big jolly guy. He was a go-to guy if you needed something. I believe he was definitely had a background as in the military. And at the start of the first Gulf War, he was called up, and I was talking to other members on this committee. It was a Walk America committee. And I said, how's Jerry doing? Has he been shipped overseas? Oh no, he's staying stateside. And I never pry with volunteers. I always like to understand from them when they're comfortable sharing what they do for work or anything like that. And I was stunned when I said, what does he do in the military? And they looked at me and they go, oh, he's a demolitions expert. And my jaw dropped, because if you ever met Jerry, he's got all his fingers and all his toes. Brilliant guy, but he is the most jovial person you'd ever want to meet. And I just had this mental picture of him with a pair of wire cutters joking around going, red or blue. Um, so I understand too from the corporate members. I saw the list that was on the website, and it's impressive, the different community leaders that are involved there. Bill Miller from Miller Drug fame, talk about somebody that's always involved in the community. Jeffrey Gratwick, David Cole. For those of you who don't know, David Cole was the DOT commissioner under Governor Baldacci, and one of his sons walked by me one day and he said, the Penobscot Narrows Bridge, the observatory? And I go, yeah, it's a great idea. He looks at me and goes, Mom's idea, and walks off. His wife Karen has done a lot in the community. Can you tell me a little bit about this corporate group? It sounds like it's a really good effort to reach out to different vocations and different people to get different perspectives and what they can bring to the table for CH&CS.
Sure. So our corporate structure, most nonprofit, well, all nonprofits, most people are familiar with the board of directors. That every nonprofit has a board of directors, and that tends to be the governance structure. And one of the things that we very much value is the fact that we are a community-based organization, and we want to meet needs that exist, and we can do that. We could be just focused insular and look out and say, well, these are the services we're going to provide, and this is what we think we're doing in the community that's good. But that can miss a lot. And so we also have, as part of our structure, governance structure, a group called corporate members. And these are members who are part of the organization, that we want a good cross section of individuals, so that we have a group of individuals who are tied into the community, that have the direct pulse on what is happening in their community, to give us feedback in terms of how can we as an organization be a better partner in the community. Where are the gaps? How are we doing? What do we need to do better? And so this corporate membership is really about being a part of the governance structure, with that lens of being able to help us to be a better partner in the community. So we're always looking for individuals who are interested in that role. It's not as intense of a role as being a member of the board of directors. There's more involved with that. So individuals who want to contribute to an organization like ours, but really maybe they don't have the time to be a member of a board. This is a good way for that engagement to happen. So I would certainly welcome people to reach out to me if they have that interest, and be willing to do that.
I like what one of the news stations had years ago, the expression "We live here too," and it's very true. Um, One of the things that I think is remarkable about Bangor is the fact the media, not only is it really widespread with all the radio stations, the TV stations, the press, and so forth, is how supportive they are of the community. You don't see the gaggle of reporters being obnoxious and shoving microphones into people's faces. You see a media that informs and might investigate, but it's all very professional. What is the experience that CH&CS has had with the media? I'm assuming it's good from everything I've ever seen.
Yeah, no, I share that perspective. I think that, we try to be a resource. So if there's a topic at hand where we can lend some expertise around, we certainly want to be available to help get that communicated to the public. And I think that we're viewed that way, as being a resource. And I think the media is fair in terms of, there should be a healthy scrutiny of any entity that is accepting public dollars to deliver something. Nonprofits, by their very nature, are intended to add value.
Mm.
That's their role. And the community should definitely be looking at that to say, is that true? Are we living up to our mission and why we exist in the community? So I think the media has a role in that. And I think that happens. And I think it's respectful. And there are times when issues surface, where the media wants to get some perspective to share it with the community. So I think it's important to have. And I think that's important for that accountability. I'm a firm believer that organizations like ours should have that level of accountability to the community, so that we are always living up to our mission and meeting those needs.
Excellent. And in terms of what's coming down the pike, are there some things that are coming up that you'd like to share, new programs? And the follow-up to that would be, in a perfect world, if there's something you could wave your hands and make a magic wish come true for CH&CS, what might that be?
Sure, great question. So the first one, we're very excited. One of the services we deliver, is a crisis service. So individuals who are experiencing a mental health crisis, the way that the state operates that is that they have contracts with providers. We're the contracted provider for Penobscot and Piscataquis counties, and so that system includes having a mobile outreach staff, and so we're able to respond in those communities, in those counties, wherever somebody wants to be seen, and engage that mobile worker to help resolve the crisis. We have crisis residential programs. This is for children and adults. And those residential programs provide some extra time for individuals to address the crisis and work through the crisis. It's a 24/7 program. But our latest addition that we plan to have open in in August. So it's given me, somewhere in we'll say the middle of August, we're in the process of completing the renovations. But it's going to be what is called a receiving center or crisis receiving center in Bangor. And it's a program for adults. Part of the crisis system is having a place to go. So there are times when people need to go somewhere that they're not in a position with what they're experiencing to wait for a mobile worker, that they need to be somewhere. And our system of care right now, rightfully, is that emergency departments are a safe place, and individuals that are experiencing that type of crisis will go to that emergency department. It's not always the best setting, but it's the safe setting. And so the crisis receiving center now affords a different place for people to go, for adults who are experiencing a crisis. They'll be able to walk in to the program, receive the focused care around their crisis, and our response at that point will be to get people to the right resources. And if they need a different type of care, we'll help to move people in that direction as well. So we're very excited about that. There's been one that's been operating in Portland for a number of years. And we're going to be one of two new programs that have started. One will be in Lewiston and one will be in Bangor. So this area will now have a new resource. And so we're very excited to get that up and running. In terms of the big question you asked, in terms of the wish for the agency, I could probably list a lot of things. What I would say is that the communities we serve are Washington, Hancock, Penobscot, Piscataquis, Kennebec, Aroostook, and a lot of communities on the fringe of those counties. So we have that large footprint. And I think for us, for me, it's getting those connections in the communities, getting more of the voice of the community. So kind of going back to what you said before around corporate membership. If there are individuals who have an interest in any of those areas that we deliver services, home health, hospice, or behavioral health, and want to get involved, to please reach out, because I think we do a much better job when we have more people involved with the organization who are able to target needs and meet needs, and identify ways that we can be a better organization. So I think that's the big wish.
I think it's wonderful too what's going on in terms of people being cognizant now that law enforcement needs support. I know Andrea Carver, for instance, works with the Bangor Police. I think she's one of two people that go into a crisis situation. You see some of the horrible things that happen in other parts of the country, and you have to wonder at, all this adrenaline that's in a person's system when they're chasing down a suspect. And for instance, what happened south of us recently, it's so important for people to understand that. I like what Stephen Covey said, we're as kids, we're told to be independent, but the reality is the way humans are wired, we need to be interdependent. And I think that what CH&CS does in the community is fabulous. We're coming up on our last couple of minutes. Is there anything else that you'd like to share with us?
Well, I would invite people to go to our website, chcs-me.org, and you'll get a much better sense of the scope of services that we deliver. So that if there is a need that an individual has, a family member, somebody, a coworker, that's always the challenging part, is to help people understand what resources exist. The other thing I would say is that probably the first service we can always provide is to be a resource. Don't hesitate to call us. You don't have to call us because you have a specific need. And you might have a question about, boy, I need that. Our staff are aware of many, many types of resources and can help people get linked to the right place. So use us as an organization also to just fact find and get your needs met. The system of care, no matter what we're talking about in terms of services, it's not always intuitive. It's not always clear about what does exist. It's hard to explain everything that does exist. So don't hesitate to pick up the phone, give us a call. going to our website, our number is listed there, and we'll be able to.
And we'll share that contact information. Well, again, thank you so much, Dale. I really appreciate you taking the time. Thank you for being a guest. And if you can hold on for just one moment.